I'm doing well. How are you doing today?
Good, thank you.
We'll just allow a couple of more seconds here for our guests and attendees to join, and then we can get started.
Sounds good.
Okay. See a lot of folks joining.
Okay.
Thank you, everyone. So I think we're right on time. So let's get started to make use of best use of your time and presence today, Leanne. So welcome everyone to Unmuted, Reclaiming Women's Health in the Workplace. I am your host, Hira Siddiqui. I am the co-founder of Science and Humans. We are Canada's largest digital health platform that specializes in hormone health, and we're uniquely positioned to deliver care and design more inclusive, impactful solutions for today's workforce, specifically focused on women's health. Today, I am thrilled to be joined by Leanne Clark. She is the Vice President of Wellness and Disability Innovation at Common Insurance Group, with nearly 30 years of experience advising some of Canada's largest employers. Leanne is a recognized leader in workplace wellness, disability management, and inclusive benefit design. She's passionate advocate for women's health and has helped countless organizations build benefits that support employees across every life stage. Welcome, Leanne. We're so excited to have you today with us.
Thanks for having me. Excited to be here.
Amazing. So I'll just take a few moments, Leanne, if that's okay, to set the stage for what we're observing is the current state of women's health, specifically focused on group benefit plans. So we strongly feel that the missing link in the in the health benefit space currently is the women's health needs. Life stage-based care such as fertility, postpartum, and menopause has been underrepresented in policy, research, and reimbursements, and which results in delayed care and in certain cases, no care at all. Reproductive or hormone health has long been considered as extremely personal and often dismissed, and hence symptoms such as brain fog, fatigue, and mood changes lead to reduced productivity, burnout, and in certain cases, even career drop off. And I know previously you and I were chatting, and you had shared a deeply personal story about yourself. So I'll have you take the stage and lead that conversation. And I'll share some questions that we have also curated for you as we go.
Sure. And you're right. Women's health is deeply personal, and benefit plans, they're getting better at trying to provide that personalized care, but definitely a big gap in women's health. And I think that's really that lack of education and awareness. And we've only really just started talking about women's health recently in the last couple of years, and openly about it. A lot of new research about the gaps in women's health care. Menopause, to your point, has always been considered a natural part of aging. And yet there's lots of jokes around hot flashes and women, being all red. And that's only one symptom of menopause. And we know that there are a lot of disabling symptoms around menopause, like you've mentioned, like joint pain, osteoarthritis, brain fog, night sweats, all of those that are very disabling for many women. And I think similarly, fertility, why it's not been really represented in benefit plans, has been around a personal choice to, have a baby. But there are a lot of health conditions, underlying health conditions that go into somebody not being able to get pregnant, like PCOS and obesity and genetic conditions. So a lot of women's issues have been chalked up to women's issues, and we just have to deal with it. And I think we're underrepresented because we haven't complained enough about it. And I think women are starting to talk now and demand better care.
Absolutely. So, Leanne, just with your 30 years of experience in this space, what do you think is the current state of women's health group benefits, and what are the gaps that we're identifying today?
Yeah, the gaps are really around that personalized care. If we look at, there was a McKinsey report that looked at the gaps in women's care, and we find that like 20 to 64 are when women are having most of their healthcare issues, which is our working years. It mentions 540,000 working days are missed every year due to menopause symptoms. And so gaps are really around not having that holistic, comprehensive coverage for women specifically.
Got it. And do we believe that expanded coverage can improve the outcomes and workplace participation when it comes to women's health?
Yeah, I really do. I think when you look at, so if I think about the real world consequences of having those gaps, right? I looked at, we manage short-term disability benefits, and I've been in that industry for 30 years. And so when I look at incidence of claims for women and men, the incidence of claims, disability claims for women is about 10% higher. So incidence being more disability claims per 100 lives. And a lot of those fall in the disability world under OBGYN. And so when I looked at our own data around that in disability, I thought, well, what are women's issues? And you see conditions like ovarian cysts, menorrhagia, fibroids, prolapsed uterus, heavy menstrual bleeding requiring hysterectomies, endometriosis, very disabling conditions that can often take women a long time to be diagnosed, especially if you're waiting a year for a gynecologist appointment. In terms of another gap, Sun Life just released a report around mental health and LTD. And so their mental health claims for LTD have hit 40%. And when they looked at that, um, half of the LTD claims submitted by women, almost half are mental health. And so we know that when women are going through fertility issues or they've had a pregnancy or they have a baby and they're going through menopause, hormones are all over the place. And often you see symptoms of anxiety or depression in that time. But I have to wonder how many women are being properly diagnosed. They're treated for mental health, but is it a hormonal irregularity that could be treated, preventing those mental health symptoms? And when we look at prevention in the workplace, you don't ever look at the OBGYN claims and think, oh, what could we do to prevent some of those claims? Yet there are so many things if you understood the root cause of what's going on. So
Absolutely.
by
Yeah.
addressing those gaps, I think you can reduce those disability claims, you can increase productivity, increase retention, engagement, innovation for women in the workplace.
Absolutely. So, Liana, I think you've touched upon a very, very important topic, which is misdiagnosis.
Mm.
We are fortunate that enterprise health over the years have evolved to make mental health benefits so mainstream. However, because of misdiagnosis, where women are experiencing or reporting mood disorders or anxiety or depression issues, where the underlying cause could be a hormonal imbalance, they're incorrectly treated by and considered as a mental health issue, treated with antidepressants. And therapy definitely has its own place and value. But if we look at the root cause of these problems and try to correct that, then a lot of these women would not be incorrectly bucketed in that productivity loss due to mental health issues and would be seeking care for the right reasons and the right medical conditions, which is hormonal imbalances. And it's astonishing some of the statistics that we have looked at over the years that as women, just because of the complexity of our anatomy, we are 100%. 100% of the women are going to experience at least one cycle of hormonal imbalance in their lifetime, whether it's in their early reproductive ages, as you mentioned, you touched upon some of the conditions there with PMS, PMDD, PCOS, and then or in their perimenopause or menopause, or sometimes even during postpartum. That was a very personal issue for myself as well, having given birth 4 times. The lack of support during those postpartum years was extremely demotivating. And at the same time, I felt that I didn't know what to do. Luckily, I was able to navigate that journey and find the right care and support. But I'm sure there's lots of women who are still struggling in navigating those issues as they're experiencing them.
Oh, for sure. And I think to your point, personally myself, right, when you look at, I think, I don't know, before COVID, I started with my very first hot flash. I was in a work meeting, fortunately with other women, and I was in the middle of speaking, and the heat just radiated through me, and I could feel the sweat dripping down the back of my neck, and I just lost my train of thought completely because I wasn't really sure what was happening, and they were staring at me. Then I was feeling uncomfortable, and so I just outright said, I think I'm having a hot flash. They laughed. Had I been in a room with men, that would never have happened. And so then I continued to struggle with those for months. Poor sleep. Every 2 hours I was having night sweats and hot flashes. Went to the doctor, who then sent me to a gynecologist, which I then waited for another 9 months to get in. All of that time going through these interruptions in sleep, becoming more and more angry and irritable, not really understanding, thinking I was, going through a mental health situation myself. Finally, I got into my obstetrician gynecologist. He sent me for blood work to look at my hormones. We found a proper treatment for me, which was HRT, and that's not the right treatment for everybody. But you have to like look at that and understand the root cause to figure out the right treatment for you. And luckily, I had somebody that could do that for me. There's so many women, including my friends, who are struggling and don't have somebody to do that investigation for them.
That's very, very accurate, Leanne. Lots of testimonies have been shared with us and our providers on the platform that reflect very similar experiences. And we all now acknowledge that there is a business impact because of the lack of access to care, timely care, specifically in the women's health space. So how do you suggest should be the starting point for most organizations to get these conversations going and then build upon them to create a more inclusive work benefit plan? What do you suggest would be those building blocks?
I would say education for starters, right? Having those open discussions, acknowledging that women's health is an actual issue, and looking at your data can help with that. So, looking at your disability claims data, how many claims are falling into that bucket of OBGYN, looking at your drug data, mental health data again, which you'll see a higher percentage of females, but it doesn't mean that those women actually have a mental health condition if we had that underlying diagnosis corrected for some people. So to build that out, I would say again, so education, talking with advisors and the carriers as an employer in terms of if you're looking for diversity, equity, and inclusion in your benefit program, making sure that women's health issues are segregated out. We have complex health issues that need to be treated holistically. So how can you, instead of having all the segregated, siloed options that we have today, how can you bring that all together to make sure women are being treated holistically?
It's great. So, a great point there, Leanne. Conversations is fundamental. I think it also destigmatizes these conversations in the workplace because if it's coming from upper level management to the teams down below, then there is an air that promotes inclusion, and these conversations then become mainstream, and women open up to each other regarding options and their own experiences. We're also observing, Leanne, that there may be lots of benefits already existing in group benefit plans. For example, using your health spending account or your personal spending account. Most employers also do have paramedical coverages where these women can also consult with psychotherapists or dietitians or naturopathic doctors. But we observe that a lot of people and in the workforce don't know the extent of their coverages. So how do we promote these conversations where education and awareness comes from the HR all the way to the workforce, so they're more empowered with the right information to make use of the existing benefits plans?
Yeah, I think that's a problem across the board. Benefit plans and communication of what's offered has always been a challenge. So when and I see more and more communications and bucketing of health conditions, right? So diabetes management and how can you access support for that? Obesity management, how do you access support for that? So now we need to pull out women's health. Okay, what is available in the benefit plan already that covers women's health? And like you said, most plans have an employee and family assistance program. They have a paramedical coverage for psychological benefits, again, addressing the mental health portion for women. Most plans are starting to get fertility benefits. It's not necessarily ideal. It often has, an annual maximum. We know women going through fertility might need more treatments within 1 year period. So having an annual maximum is limiting. So there's like buckets, like you said, healthcare spending account, personal spending account. Often you're seeing maximums of $500, which if you're a woman and you're trying to deal with your own personal health issues, $500 maybe isn't enough to be able to cover some of these personal services. So I think while there are benefits currently that support women's health, it's not well packaged, it's not well communicated. So a lot goes into how can you pull out and communicate that properly, and then fix the benefits that are the gaps that are missing in the benefits coverage.
Absolutely. And one of our audience here has raised a very good point that maybe as a starter, relying upon these buckets that are already existing in group benefits plan could be a good way to start and explore the utilization rates within your workforce and go from there and build more comprehensive plans. However, relying upon these buckets, especially the HSA, which is a family fund, would not be ideal. A lot of us like to use these for our children and, extended dental plans
Open,
and
yeah.
yeah, dental work and braces and whatnot, which cost an arm and a leg to begin with.
Yeah.
So it's not ideal. But what would be that ideal state of the group benefits, which is not having to rely upon these existing buckets?
So, what I would love to see, honestly, and I've talked to a few insurance carriers about this, is having nurse practitioners added to the pyramid. So, right now, today, you have your pyramid bucket, which is usually higher, especially mental health. A lot of companies are pulling that out as its own, maximum of $2,000 or $2,500. And then you've got your physio and your naturopath and your osteopath and your chiropractor and your massage all bundled under pyramid. But if there are many nurse practitioners, including those under Science and Humans, who are specializing in women's health issues and hormonal health, where if that's what I want to use and that's the support I want to get, the nurse practitioner can work in their own private clinic or their own at a private clinic or their own clinic themselves, and they can bill the employee. Which then, if I could get that reimbursed through my pyramid instead of having to use my healthcare spending account, that would be ideal. I think we need to start there for sure.
Absolutely. And paramedical buckets often, Leanne, have such underutilization rates for many reasons. You've touched upon a few because most of us don't even know what all is included
Yeah.
in our benefits plan. So having added those extra resource coverages would go a long way and improve utilization rates for the workforce as well.
Yeah, and I know employers worry about increasing utilization means increasing renewal rates, right? But there's also the balance of if I can access, let's say, a nurse practitioner through Science and Humans who can have me look at me holistically and do the proper blood testing and diagnosis for me and get me the right treatment, now maybe I'm not accessing the paramedical for psychological benefits, or I'm not accessing my EAP or other reactive benefits that are available.
Yes, yes, correctly. And that I think it's also very important to highlight that we either cover for these conditions, upfront or downstream, the financial impact on plan sponsors because of a lack of access to these care resources could be exponential. Especially, you've touched upon disability, short-term and long-term,
Yeah.
and chronic disease management costs, which is a substantial contributor to your drug coverage plans as well. We know women in midlife who don't have access to the right resources and care, especially pharmaceutical care, are at high risk for type 2 diabetes, chronic conditions such as cardiovascular health, inflammation, and whatnot. So, having covered these conditions upfront will at the downstream have a very exponentially positive impact with reduced drug coverage costs and disability costs.
100% agree. There's a quote by I'm going to forget his name now. Richard Branson, that says, if you don't invest in wellness, you're going to spend on illness. And it's the same thing, prevention. If you look at women's health, in the McKinsey report, I think it talked about if we can close the gap on women's health, we can boost the global economy by $1 trillion. So
Wow.
think of that cost in women's health because we're not addressing it. So
Wow.
the same will go for employers and that 540,000 missed work days for menopause symptoms. They say 75% of women with going through menopause symptoms find them disabling. They interfere with their life,
Mm.
interfere with their work life. So these women are either leaving the workforce or they're at work and they have presenteeism, so they're not fully functioning, they're not as productive, or they're leaving the workforce altogether. 10% are leaving the workforce, which is unthinkable. But those are
Exactly.
all costs to an employer by not managing this.
And especially women in that middle age group, Leanne, they're at the top of their careers. We have worked, each one of us have worked so hard to
Yeah,
be in those positions. So having to leave the workforce at the peak of our careers, I strongly feel is a strong act of injustice, which, there is a moral responsibility on plan sponsors and insurance to try to correct that. And the astonishing statistics around replacing one of these resources at the peak of their careers ranges anywhere between $30,000 to $40,000.
yeah,
So either we pay for that, in terms of providing coverage and resources, or downstream having to replace these valuable resources is I think it's a very easy decision, right?
yeah.
Even mathematically, it's a very easy decision.
Hmm. Well, you look at the cost of 1 day of absenteeism for a woman that's in her career, further in her career. You prevent 2 days of absence, and you've paid for any preventative solutions that you might be thinking about.
Right. So just on the brokerage side, Leanne, what role can plan advisors and brokers play to enhance and improve more inclusive workplace benefits?
I think, as I mentioned earlier, employers today are really focusing on DEI in their benefit plan. And so
Mm.
including women's health is a big piece of DEI. As a broker, I think it's important, or a consultant, to understand, first of all, women's health needs, where the gaps are in the benefit plans, and to be an advocate for employers. And so talking to the carriers about what they should be including and the innovation that they need to go forward with. And so again, so understanding, being educated, making sure they're talking to employers about what are the needs in their population, and then being that advocate with the insurance carriers. And from an insurance carrier perspective, I think I mean, I worked for the insurance carrier for years and years in my career, and it's just staying up to date on what are the hot topics going on, and keeping employers up at night. And we know obesity, we know diabetes, we know mental health from years back, and we've come so far with mental health. I
Yeah.
think women's health is where we were at, 12, 15 years ago with mental health. So let's, make sure that we're being innovative and flexible and inclusive in our offerings.
Got it. And I think being data driven, Leanne, would also be very, very beneficial. You also touched upon that theme earlier. However, just educating plan sponsors on the changing needs of women's in the workforce could be very beneficial, especially because midlife women is the growing demographics of workforce in Canada. So if we are not meeting their needs, then we are jeopardizing not just their wellness. And, as we say, women's wellness impacts not just their own bodies and their own personal lives, but the communities at large. And then there is business impacts that you've also spoken about. 1 in 10 women, 10% of them actually end up leaving the workforce because of these lack of resources and care. So we, as on the digital health provider side, Leanne, can also do a lot in providing access to plan advisors to be more data driven, because we've seen so many patients over these last few years. If I talk about my own personal experience with Science and Humans, over the last 4 years, we have treated close to 40,000 patients. So
Wow.
we are residing on a lot of data that can be very empowering and really change the narrative of some of these conversations.
Yeah, that's great. And you're right, data is a big piece of it, and measuring your data, getting your bench line, and seeing what improvements are made when you do add these additional benefits and supports.
So, Leanne, I'm sure there's lots of CHRO and CFO personnel that are watching our conversation today. What's your first recommended action? Where do they start? How do they build upon it? All the way to then executing on more inclusive workplace benefits focused on women's health.
I think it really starts at this point with education and awareness. I think it's similar to, manager mental health training, the anti-stigma campaigns we had years back with the Not Myself Today, getting that awareness, having those open conversations in the workplace. So it's not shrouded in mystery and, being a woman's issue. So I think that would be the first place to start. Communication, active listening, surveying even in terms of what are women looking for in terms of support in the workplace and with their benefit plan.
Got it, got it. And we're seeing more and more digital health platforms also come into this space. And really, the agenda is to improve accessibility. So, including those digital health resources, we strongly believe can also improve access and clinical outcomes. Science and Humans is one of these resources. There are other great resources as well. But having such a diverse and spread out demographics of women coast to coast in different languages and different locations, it's really hard when we are relying upon in-person or brick-and-mortar resources. So having included those digital health resources, we fundamentally feel can really change the scope of accessibility in this space.
Yeah, I 100% agree.
Great, great. So, just in terms of the cost associated to these, Leanne, I know there is a cost and benefit, calculation. Plan advisors and brokers can really help educate plan sponsors to make those decisions wisely. You've also touched upon some of the existing buckets or the new buckets that can be created, so we don't have to rely upon HSA funds necessarily. And your notion around adding nurse practitioner coverages in paramedical is extremely innovative and transformative. What does it take to get that executed? Is that a decision that's currently residing with insurance companies, or is there a regulatory aspect that needs to come into consideration? Or what does it take for us to get to that point where we can see more coverages for prescribers?
Yeah, great question. And I've had a couple of recent conversations with some of the insurance carriers about exactly this. Like what would it take for them to start adding nurse practitioners under the pyramid? We had to expand the mental health bucket and the practitioners allowed there. Used to be psychologists, now they're adding, a psychotherapist, registered counselor. So the bucket has expanded. So I know one carrier did say to me, well, we have to look at, because nurse practitioners bill through public health. Well, yes, if they're part of a doctor's clinic, they're billing through public health and it couldn't go under the pyramids. But if they have a private practice, just the same as a chiro or a physio, they can bill the patient directly. And so, in my opinion, I don't understand why it couldn't be added as a paramedical coverage. So it lies really at this point with the insurance carriers to decide if they can do that. And then I think it comes down to if an employer wants to include that in, what does that look like in terms of pricing? And so the carriers would have to come up with what additional pricing would be involved in that.
Got it. So, Leanne, have you or other folks at Coven have had any conversations recently where plan sponsors are now looking for coverages? Have we made it that far that there is a need that is determined in the industry, or are we not there yet?
There's definitely a need and a lot of requests for what can we do to support women's health. And so whether, it's education or, expanding the healthcare or the personal spending account, I think we're still at the cusp of coming up with what does that look like? And especially when it comes to hormone health, that's not something that's really been considered. And yet we know hormone health is so important as research is coming to light around obesity, right? Ghrelin and leptin are hormones involved in chronic disease obesity. We know it's a part of type 2 diabetes. So as we now learn more about the impacts of hormones on women and many of these other conditions, I think hormone health as a bucket needs to be added in. And so we're not there yet, but I think with conversations it'll be soon coming. And I know, I mean, you look at Green Shield, for example, who is a very innovative, forward-thinking carrier who is starting to offer hormone health, and they're adding solutions like Science and Humans in terms of allowing women and men who also we know go through hormone issues to have that full holistic assessment, understanding your health history and what is the right targeted personalized treatment for you to deal with your issues.
Great, great. So definitely, we'd like to take a moment to applaud the efforts of Green Shield Canada. I think have been lots of conversations in this space, which have been extremely enlightening, educating the industry on the evolving needs of women's health. However, the underlying reason for these conditions, which is hormonal imbalances, is still very unaddressed.
Mm-hmm.
So we do, acknowledge that the innovation that we've seen with Green Shield, they were very, very quick to understand and address the underlying needs of the changing demographics of workforce. And essentially, they are the first insurance company in Canada to be able to provide hormone health support for both men and women across all reproductive age groups. So starting from fertility to postpartum, perimenopause, menopause, and then on the men's health side, addressing the needs of the midlife male workforce population with andropause is extremely, extremely commendable. And I hope that others also follow that route to make this more accessible. So definitely that's a great starting point. So Leanne, just as closing comments here, I know we've spoken a lot about the current state and the changing, evolving mindset in the benefit space, but what does a future ready benefit strategy look like? It may not be available in the next few months, but hoping that it will be available in the near future. But in ideal state, what does the future ready benefit strategy look like that has a very comprehensive and inclusive approach to address the changing needs of the workplace and demographics around hormonal health conditions?
Yeah, future ready. I think it's again understanding and acknowledging women's health issues and how many complex health issues we have, and treating women's health holistically instead of all the siloed approaches to what's accessible. Having a plan design that has a focus on doing the proper assessment, being able to talk about all of your issues, doing the proper testing, and then that personalized treatment and care. I think ideally, I'd love to see hormone health and access to a nurse practitioner or a specialist that knows the complexity of women's health and that could treat me holistically. And I know friends who have paid out of pocket for a nurse practitioner who can address their women's health issues. So I think really future ready is making sure that you've got that comprehensive, holistic coverage.
Got it. And Leanne, I think you've touched upon a very, very good point here, which is the holistic and comprehensive aspect of the women's health. I think women's health in some shape or form is available. However, that experience currently is so fragmented that the patients are having to run in 10 different directions without understanding how to prioritize that experience or how to streamline that experience. They have, of course, with the changing, hormone levels, women experience mood changes. They see changes in their metabolic health. All of a sudden, we start gaining weight around the midsection of our body, not understanding where that came from. All of a sudden, we have changing in cardiovascular markers, which are unexplained. I cannot tell you how many women come to us and tell us that they are living an absolutely active lifestyle. They have a lot of focus on nutrition and movement, but all of a sudden, when we test their biomarkers, they have an extremely abnormal lipids panel, and it's coming out of the blue, completely unexplained. But the underlying cause, as we understand now, is the changing hormone levels or the fluctuating hormone levels during this midlife, transition. There are reproductive, issues. There are sexual health issues. That is the area that we believe is the most undiagnosed, untreated, and the reason being that it's almost never spoken about.
Yeah.
Yes, there are other aspects of perimenopause and menopause that women experience, but we do speak about them. But the sexual health aspect of that care, especially around recurring UTIs, painful intercourse, they almost never get spoken about, but they're still a big part of our lives as we're transitioning into midlife and beyond, right? So
Yeah.
there are aspects of care that are there with mental health and reproductive health and metabolic health, but it's the experience is so fragmented right now that the patients are having to run in so many different directions to be able to get the full spectrum of care that they deserve.
Yeah, no, agree. And to your point, like when you go or you call EAP because you're feeling anxious, and they don't think to ask you holistic questions around, oh, have you been to a doctor to have, blood work done or your hormone levels checked? Nobody thinks of doing that. Um, and I mean, I'm just fortunate that I had a doctor that referred me, and I waited 9 months, but honestly, within a week of starting for me hormone replacement therapy. The hot flashes were gone. So the night sweats were gone. I was sleeping through the night instead of waking up every 2 hours. So when you get better sleep, then you're more productive. You don't have the brain fog. You're not as irritable. So just like that, that's all that took. And now I'm a more productive employee, right?
Absolutely, absolutely. I think so many women with proper care, and of course, ruling out contraindications, because we do acknowledge that HRT is not for everybody, but it is applicable to a big patient population as long as we're doing our due diligence and ruling out contraindications, starting women off on the right doses, not over titrating or under titrating, where they get the benefits to where HRT is cardiovascular health protective. It protects their cognitive function, their bones and muscles. It can be extremely life-changing, and it works fairly quickly.
Yeah.
As you're indicating, it does not take for too long for patients to start experiencing the benefits of these treatments.
Mhm.
Over the last few years, we have run multiple studies on our cohort of patients as well, Leanne. And within the first 3 months of treatment, 96% of the women report fewer hot flashes, while in some cases, they could be experiencing a hot flash every hour of the day going through the nights as
Yeah.
well.
Yeah, I was every 2 hours on the clock. I could look at the clock. It was not fun.
I'm glad to hear that you were able to find the resources and time. And something to highlight here as well is, unfortunately, women are working with a window of opportunity when it comes to HRT. There are multiple studies that indicate the effectiveness and the safety profile of HRT. But if it's initiated within the first 10 years of menopause, then we do observe that the clinical outcomes are exponentially improved. After that, it is really a risk and benefit conversation
Yeah.
between the practitioner and the patient. There is nothing to say that HRT cannot be initiated at that point, but we really have to then look at the risks and the benefits, and collectively that decision is made between the prescriber and the patient. But if we initiate therapy within the first 10 years, we're not only observing exponentially improved clinical outcomes, but we are also introducing HRT that then protects the bone, the muscles, the brain, and the heart, and so on and so forth.
Yeah, no, definitely. And to your point, you're right. There are health histories that prevent women from having HRT for sure. But the nice thing about speaking with an expert on women's health is if that's not an option, they can still provide recommendations around sleep hygiene, around other natural supplements that may help with sleep or with hot flashes if they can't do HRT. But you're not going to get that from talking necessarily to your doctor. Some doctors are great, but a lot of people don't even have a doctor today. They're going into a walk-in clinic or an urgent care and seeing somebody different all the time who doesn't have any idea of their health history.
Yeah, yeah, that's definitely a problem to acknowledge, especially in Canada, because we have about quarter of the population does not have access to a primary care provider. I've unfortunately been a part of that 25%. The only time that I've had access to a doctor is during pregnancy. just to deliver the baby. And after that as well, when, personally, as I mentioned, I had experienced severe episodes of hormonal fluctuations. I did not get access to care. I could not go back to my OBGYN to discuss that as well, because essentially, their work is done as soon as the baby is delivered and you're on your way home without proper support and care, especially as a cesarean section mom. I think my experience was a lot worse than some of the other patient populations, but regardless, having access to the primary care provider would have been extremely beneficial in that phase where I felt completely unsupported. And to your point, Leanne, for the patients that do have access to a primary care provider or they're going into the walk-in clinics, there's also something to acknowledge that most family doctors are not trained enough in this space around hormone health. We look at statistics which are extremely astonishing. There is about 4 hours of organized training in medical school that is available to doctors, where they're essentially learning how to address hormonal imbalances and create a personalized treatment plan. And on the contrary, some of the work that Science and Humans has done is to build our own hormone academy. So any prescriber on our platform has to go through about 200 hours of organized training and shadowing with specialists on the platform and write a certification exam. So we make sure that they're fully educated and feel experienced and confident in their approach to treatment before they can even see their first patient on the platform. So we've been able to, luckily address that gap in the education space as well, to be able to build that robust engine where we produce or convert a generalized nurse practitioner or healthcare provider. And through this rigorous training program, they are then able to become specialized personnels in hormone health. So that's definitely something that I'd also like to encourage other healthcare providers to offer, so we can have a increasing cohort of healthcare providers that feel confident in their approach to hormone therapies or non-hormonal options, as you mentioned.
Right.
There's
Yeah.
lots of great non-hormonal options also available to women, some supplements, some pharmaceutical options as well that could be applicable to that patient cohort.
Yeah. And
So
your training, and I know you have Dr. Christy Prouse is your chief medical advisor, I think.
yes.
Wonderful woman, OBGYN, right? And so kind of in my, age band, you're younger than me here, but in my age band, in terms of really understands what it's like to go through the stages of women's health. So couldn't have a better person doing all the training for your
Absolutely.
staff.
Over the years, she has treated some over 30,000 patients, women with hormonal imbalances. And her expertise not only just comes from the fact that she is, by training, she is an OBGYN, but she has a double board certification in functional medicine. That is
Yeah.
the foundational element of the women's health program that Science and Humans has been able to build, because we rely upon a whole body approach to treatment. We don't see a woman's organs in silos, but as a complete body. And what that allows us to do is not necessarily throw pills and prescriptions on symptoms, but look at the root cause of these problems.
Yeah.
Sometimes you could be prescribing the right amount of doses to women for especially around hormone replacement, but if they have a leaky gut, or if they have liver that is not performing an optimal function, then women are not able to absorb the hormones that we're prescribing to them. And essentially what ends up happening is that the prescriber keeps titrating the dosing higher and higher, but essentially that is what puts the patient in harm's way. So if we fix those gut issues, if we make sure that the liver is in optimal, working condition, and the woman is not experiencing a state of estrogen dominance, then we essentially are able to identify the lowest possible HRT dose for that candidate, where all her symptoms are mitigated, and we are not prescribing them essentially the higher dosing, where the side effects with hormone replacement therapy essentially comes in. So that approach to integrative health has been extremely crucial to the success of the women's health program on our platform. Had that not been there, I
Yeah.
don't think I don't understand, or I can't imagine a world where we would be delivering women health on our platform. So I would essentially also encourage other providers to look into that approach. So we're providing optimal women's healthcare without putting women's in harm's way, especially when it comes to HRT. So and at this point, I'll just take a few minutes to see if we have any questions from our audience. We are almost towards the top of our hour. And I think one of the questions that have come is a really good one. You have already addressed, but I'll just take a moment to also review that just to see if you had any additional thoughts. One of our attendees is mentioning that the coverages should not fall under HSA, which is also essentially available to men or families because this is a women-specific issue.
It is, you're right. And I mean, that's just the easiest right now. I think the nurse practitioner under the paramedics is where we need to go with this, or a PEPM, just like you have virtual healthcare right now. This is basically virtual healthcare specific to women. So maybe it's a PEPM model under that. HSA is just the easiest place to plug it. It's not the right place. I agree.
Absolutely. And something that we're observing, with our partnership with Green Shield Canada, as we collectively agree, they have been extremely innovative in this space. And their focus is essentially also not to target these buckets because we acknowledge that these are available to the entire family, but embed these programs into the existing group benefits with plan sponsors. And then once we have more data around utilization rates, then there could be a conversation around increased premiums. But we have had, I mean, many conversations with them, and those increased premiums are nowhere scary as I had, initially envisioned. How will the plan sponsors respond if, year two, we're looking at about 10% or more increase in premiums, but the reality is that the premium increase would be very, very insignificant. So at that point, I think it's a win-win where plan sponsors are able to offer very inclusive group benefit plans and without taking a big, massive hit on their budgets for these programs as well.
Yeah, agree. Hopefully we get there. More of this, right? Education awareness. I think about my own personal journey, and to tell you the truth, the first time I had a hot flash, that's all I thought was involved in menopause was a hot flash. I didn't realize all of the other pieces, the brain fog, the irritability, the anger, the sore joints, things like that. And so it was a real awakening, and I learned a lot through this. And I think a lot of women don't have that explained to them. We go through life knowing that, oh, you're going to have menstruation and pregnancy if you're lucky, if you don't have fertility issues, and it's not talked about. We're women are very strong, and we don't talk up a lot, and it's time to be more vocal.
Absolutely. And specifically those benefits that are available on every reproductive phase of the women's life, all the
Yeah,
way, like you said, from puberty, that's necessarily where it needs to start. Then
yeah,
coming to fertility and postpartum and perimenopause and menopause and beyond. Because even with the two people on this webinar, Leanne, we've had very similar and at the same time different experiences with the challenges that we've experienced.
yeah.
And women in different age groups have very diverse needs. But at the same time, if those needs are not met, in a proactive and a timely fashion, then there are long-term impacts to not just the overall health and well-being of the women, but also there is a business impact that we have discussed today. So
Mhm.
definitely investing in women's health is a win-win, both for women and for businesses in Canada and around the globe. So I'll just take a moment to thank you, Leanne, for your time and your contribution to this conversation today. We're extremely fortunate that you've been able to support the journey with Science and Humans as well, educating us on the needs of the diverse workforce that we have today, and will continue to explore and pick your brains on working towards developing even more inclusive and comprehensive group benefits plan together.
Great. Yeah, thank you for having me, and wishing you guys the best of luck. Hopefully see you in lots of benefit plans going forward.
Thank you so much, Leanne. And thank you to the audience who joined us
Oh, thank
today.
you.
Please feel free to reach out to us if you have any questions or any comments, or if you'd like to explore partnerships with Science and Humans, or you'd like to reach out to Leanne with any questions around group benefits. I think collectively we'll be more than happy to answer your questions. Thank you, everyone. Take care.
Thank you.
Bye-bye.
Have a great long weekend.
You too. Take care. Bye-bye.
Bye.